Welcome, everyone, to today's Dental and DSO panel webinar. Dental providers turn toward automation to solve staffing and patient engagement hurdles. I'm Brian Zimmerman with Becker's. Thank you for joining us. So before we begin, I'm going to walk through a few quick housekeeping instructions. Today's webinar will be a panel-style discussion, and we will have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you have trouble with the audio or visual, try refreshing your browser. You can also submit any technical questions into the Q&A box. We've got a crew online that can help you out there. And at this time, I want to thank our sponsor, Rectangle Health, and introduce our panelists. So today we're joined by Bradley Dykstra, CEO, MI Smiles Dental Group, Theresa Williams, COO, Dental Express, Bob Eisen, Senior VP, CHRO, Western Dental and Orthodontics, Kaisel, COO, Pro Health Dental Management, and Brian Doyle, VP Enterprise, Rectangle Health. Thank you all for being here. And Brian, I will turn it over to you to share some opening remarks and set the stage for our conversation here.
Thanks, Brian. Good afternoon, everyone. Thank you for joining. My name is Brian Doyle. I'm the Vice President at Rectangle Health. I've been working closely in the dental market and specifically DSO market for the better part of 12 years. And this topic is very timely, in my opinion. We have seen a massive shift in things like automation in an attempt to improve and enhance staffing workflows, and then conversely, the patient workflow. So on behalf of Rectangle Health, I want to thank Becker's for being a great partner, as well as this amazing panel that has volunteered to go through their insights, their day-to-day, what they're seeing. I think this is a very timely conversation, so I'm really excited to hear what everyone has to say. And on behalf of Rectangle Health again, thank you very much for joining.
Thank you, Brian. Let's dive in here. So right now I'm going to ask each of our panelists to share a little bit about their role and organization so you can appreciate their perspectives, but also just share any work that they're currently doing to address staffing or workforce efficiency issues. Kai, perhaps we can start with you.
Good afternoon, everyone. My name is Kaisel. I'm the CEO with Pro Health Dental Management. We are a 14-office group based in the Metro New York area. And one of the things that we are working on is to make our workflow more efficient in terms of the insurance eligibility verification process. And we're also looking at automating our claim posting, A35 posting process. So glad to be a part of this discussion.
Glad to have you here. Thank you so much for sharing that. Theresa, same question to you, just sort of open up here.
Hi, I'm Theresa Williams. I'm the COO at Dental Express. We are a DSO in Southern California. I'm kind of a transplant from Oklahoma City from about 7 years ago. I've been in this industry for a little over 26 years, and one of the things we've seen, especially coming through the pandemic, is we need ways for our employees to be able to better connect with their patients and not be dragged down by a lot of the repetitive, mundane tasks. And much to what Kai said, we can automate things in the RCM department is probably the lowest hanging fruit there. But since we're in a market where the average person is using a QR code easily and is really digitally engaged, I think we're really primed as an industry now to really specialize those things and be able to implement them in the dental practice where we might have had resistance before.
Yeah, things have certainly changed, and you might have more adoption. People are more willing to work with that kind of technology.
On both sides, yes.
Yeah, absolutely. Great. Bob, why don't you go next?
Well, good afternoon, everyone. I'm Bob Eisen with Western Dental. I've been with Western Dental for about 5 years, and Western's been around over 100 years, and we operate over 5 states, and we have about 350 dental offices across our footprint. And in addition to what Theresa had alluded to, as well as Kai, we're looking at ways at automating and making it easier for many of the transactions that we do to be more efficient. One of the other areas that has been of great interest to me, there are a number of products that we make available to our patients as it pertains to maybe soft tissue management as an example, and making an online store, if you will, so as people are looking for their refills of certain products, they can go online, shop for it, and have it delivered, making it easier to get those items as they may need it. So another touch point, if you will, amongst many other things. But thank you for the opportunity.
Thank you so much for being here, Bob. And Bradley, why don't you round us off here on this introductory question?
Okay, I would love to do that. I guess I'm the odd person out. I'm actually a dentist. It's been over 43 years. I'm actually no longer at the chair, but I am the founder of the organization. We actually turned it into a DSO several years ago. So I'm the visionary. I am the clinical director, where my role is to find the doctors, mentor the doctors, keep that part going. And from when I got out of dental school till now, I've loved technology. There's not one thing that we do that's similar to what we did then. From digital radiography to digital records to digital intraoral cameras to scanning to milling, all the way around. And so what we're trying to do is the same area in all the back-end functions and the front desk. Anything that we can automate now, we certainly try to, as long as it gives a patient hopefully a better experience, or certainly no worse. But certainly we want the best experiences for the patients, and we want the best experience for our team members. Like someone said, having to do mundane things over and over and over, that just brings me back. A good analogy was digital radiography versus the old way. The amount of time that saved, so everyone, the clinicians, could spend a lot more time with the patients and not out of the room doing other stuff. So that's what we love.
I appreciate you sharing that, Bradley, and thanks for being here and offering your perspective to our audience out there. Brian, I want to turn back to you and see if you could just share from your perspective what you're hearing from your fellow panelists here, and anything you'd like to call out.
Yeah, thanks, Brian. So on the software side of the things, on the side of the world, it's been interesting to see the change. What we're going to talk about, and a lot of the functions that are out there have been out there for a very long time, and our retail experience has proven that. Healthcare, specifically dental, we weren't quite there yet with a lot of the outward patient engagement, patient-facing kind of streamlining processes, and there's a good reason for that. Is healthcare is a very personal experience. I think what we're going to find fascinating as we go here is that technology has not only been adopted, it has been asked for by the consumers or by our patients. So on the software side of the world, we found it to be very well adopted, not only by the consumers, but then I think Theresa mentioned by the staff as well. So it's a pretty exciting time to be in this industry. And we just see things becoming more and more streamlined and automated, and all those good buzzwords we like to throw around. Software has been the driving force behind that.
Appreciate that, Brian. And I want to get to now sort of getting back and really talking about the driving forces behind workforce inefficiencies that have sort of plagued healthcare and dental care for quite a while. But I want to see if some of these efficiencies, perhaps inefficiencies, were also pandemic related, thinking about work from home orders, distancing, staff illness, or general just day-to-day challenges like time-consuming workflows, the stuff that needs to be automated by software, a combination of both. Are you coming up against both of these? Are they interrelated, interconnected? Can maybe Theresa, you can start. Can you share a bit about the challenges, the workforce efficiency challenges that you're trying to address? So
I think what you're talking about there, through the pandemic with the work from home, I think it it accelerated things like Brian said. This technology's been around. We've been able to make online appointments. We've been making reservations for over 10 years for restaurants. Why now that we're making online appointments? Why now are we offloading some of these traditional tasks that were done in a front office and a dental office onto computers and onto centralization? And the pandemic accelerated it, coupled with the labor market. And people, when they began to re-enter the workforce, they were a little bit pickier. It's a commodity to get an intelligent person to come and work for you. They want challenging work. They want engaging work where they're talking with people and they're not talking, they've been on the phone with insurance companies talking to robots for some time. Why are we just now deciding, why don't we let robots talk to robots? They're not going to get tired of each other. So the pandemic definitely accelerated it, but I think it was already a long time coming and it needed to happen. And I'm seeing better engagement from employees now. They're happier in their jobs. They're proud of the work that they're doing. It's not that we replaced them with computers. It's that we freed them up to be really great with their patients. We freed them up to increase numbers of appointments and patients that we're able to take care of and better touch points.
And Theresa, follow-up question there, thinking about sort of they're able to focus more on the patient. They're able to do things more for the patients. Do you think the messaging behind sort of automation was perhaps trickier before the pandemic, sort of getting around, like getting that buy-in, like they're a little bit maybe afraid of the technology? And now after we've wrestled with COVID and had to make big transformations across the dental industry, do you think now it's just kind of easier to have those conversations where perhaps before it was a little more loaded?
100%, Brian. I think we, and our front office teams and some of our management even, they were worried that the patients were going to reject it. And so they were worried, for the patients. The patients didn't even give them the opportunity to accept or reject something. But then through the pandemic, they started to see their grandmother using the QR code to order takeout. And so if your grandmother can order, take out with her QR code, she might be able to fill out her new patient paperwork on her cell phone or at home before she comes. And so I think making these platforms just so much more accessible to where it wasn't download paperwork, fill it out, rescan it back in, some of the older antiquated ways that we engage with patients on an electronic front. And people started to see that and they thought, people are a lot more capable than we're giving them credit for. And, be prepared. If someone comes into your office and they need it to be analog, be prepared with a few sheets of paper ready to go for them. But you don't need to build your whole practice around that one patient that struggles with compliance.
Right. That makes a lot of sense. Yeah. When you have a QR code at every restaurant, and it seems a little silly when a patient walks in, you're asking them to do various old automated tasks, analog tasks. But yeah, I appreciate that, Theresa. Kai, I'll come back to you now and see if you can build on that. What are the driving forces behind some of these workforce inefficiencies? And can you speak more to how you're tackling them?
Yes. So I agree with Theresa's assessment. And the one thing that I want to add is, is really patient expectation, right? Patients, their expectation of service have been shaped by, the convenience that they have received from other industries, whether it's banking, retail. We all have our banking apps. We can do banking 24/7. And I don't know about you, but, I haven't been inside a branch for a very long time because all my basic needs are met with, by the app. I can click on 3 clicks and order the things I need from Amazon. So I think that expectation is also driving what's happening in the healthcare field. I think this, expectation for convenience. And I would argue that, those organizations that can, manage and deliver customer experience and meet their expectations, they really have a strategic advantage in this rapid evolving, dental field. So.
Yeah, absolutely. And can maybe Kai, can you speak more to the role technology is playing here? Like, what specifically, I guess, are you using? Can you talk more about to sort of meet those patient expectations that have been very, very much changed
right.
in recent years?
Right. So So I can just share with I'm fairly new with Pro Health Dental, so I will speak on behalf of my experience here as well as my experience overall since COVID. One of the things with COVID is that patients come in and we still have many offices that are handing out a lot of paper, or even the ones that are paperless. The irony is that they still have a lot of paper floating around the offices because the insurance companies are still sending them tons of paperwork. Our specialists are sending us tons of paperwork. So it's really, one of the things that we're trying to tackle, and I think we're making good progress, is really, looking at a digital flow. Like Theresa said, patients come in. There's no reason to, have a piece of paper and fill out all the patient's name, address, and phone number and all those things. You take out your driver's license, everything's there. You scan that code, it captures all their current information. And really it's this digitization of a workflow. So we look at our patient journey. We look at all the different steps from insurance verification to how we capture patients' information to all the consent forms and post, visit instructions. So we look at all the entire patient journey and really ask us the question, what can we do to make that experience fully digital? And of course, that will, the premise is that it's going to help increase our productivity, but more importantly, make it easier and make it make us the preferred choice of provider, when patients come to our offices.
Yeah, I really appreciate you laying that out, sort of looking at the various sort of touch points in the patient journey and asking, can we digitize this? Can we make this simpler, easier for the patient? And tackling automation like that, right? Really trying to pinpoint those areas that are ripe for transformation. Bob, I'm curious if you can jump in here as well and share what role technology is playing in sort of addressing some workforce inefficiency issues. You can share more about that, right, or even maybe some of the driving factors, or just weigh in on any of your colleagues' comments so far.
Okay, well, I've been on the edge of my seat for this because it's an exciting time. And as Theresa said, a lot of this has, certainly been destined to occur. And I think I would agree that the pandemic merely accelerated much of what we're seeing today. When you look at healthcare, the expectation of healthcare is to deliver quality care, deliver affordable care, deliver a great patient experience. And also, in order to do that, the enabling piece is deliver a great team member experience. And so as we talk about removing some of the mundane things that frustrate people, that bog people down, I look at that concept as highest and best use, right? What do we need to be able to move off the plate of team members that can be automated, or what can we do to make ourselves easier to interact with our patients, whether it's to get their feedback on an iPad survey or enabling them to scan a QR code to get at new patient forms or to update things. And there are many things that we're doing with our team members that we've been working on, being such a distributed workforce and having touch points that are very interactive and self-service. So many things kind of tie together that have been accelerated, whether it be a result of remote working or just easier access by patients. Another area that I think many of us are doing are some televisits or different types of consultation, enabling a patient to get a little bit of information before they have to come down to the office. Maybe in our case, we're talking to somebody about a clear aligner case. We're able to follow up with an orthodontist on an initial consultation once the patient's been in and the orthodontist has some information, but they can have a consultation through a video chat, just making that process a little easier, a little more convenient. So technology is touching us in every aspect of what we do to deliver on what we've probably all heard of as that quadruple aim. again, the quality, cost, patient experience, and team member experience.
And technology is really, do you see it now as maybe the primary lever to perhaps achieve the quadruple aim?
I wouldn't say a primary level, but certainly an integral level. There's a lot of things. I don't think there's anything that takes the place in a clinical setting of that experience the patient has, that understanding. And one of the things that we do that we actually use technology for, we may be presenting different types of cases based on a diagnosis. We can provide, or enable a patient to review short videos explaining the procedure and educating that patient prior to their accepting the case. So if they're been diagnosed for a root canal, we can give them a video to help explain, well, what is a root canal? How does that work? Why do we do it? So that, giving that patient more information, a better experience, more comfort, and doing it efficiently while the caregivers can then answer some follow-up questions, but the initial explanation can be done, by a video module. And people are so accustomed to getting information this way, it's certainly well received. But nothing takes the place of a good experience and good service when somebody comes into your clinic or your environment and being friendly, knowledgeable, and efficient. So I think, like I said, it's an integral level, but not the only level to drive us to the quadruple aim.
Right, but technology can sort of, if I'm hearing you correctly, the technology experience that surrounds the patient can perhaps enhance that in-person visit. If the information has been shared ahead of time, there's automation, patient engagement, patient education, and by the time that patient gets in front of their dentist, it just allows for a better experience face-to-face too, right?
Absolutely. You look at it as enabling.
Right.
It enables that process, that experience.
Thank you, Bob. Appreciate it. Bradley, I want to turn to you now, and can you talk about the role technology is playing to address specific workforce workflow inefficiencies at your DSO?
Well, I want to just preface this with historically dentists or their staffs have been very resistant to change. Okay, they have a system that works, why change? That being the background, the pandemic caused us to change. All of a sudden, it's like we can't have people in the reception room. So we go to curbside check-in. We want to do as many virtual visits, i.e. teledentistry, and we were already starting to do that before the pandemic started. So like all these fine people have said, the pandemic caused us to start using what we already had. And once we found out stuff started working in dentistry, we thought, oh, what else can we do? And yes, you come to the realization people want to do everything on their phone, from making appointments to making payments, because like you do for restaurants, like for anything else, why can't we do that? But the way I like to look at technology too is it's never technology for technology's sake, but what problem is it going to solve, or what experience is it going to make better? And that's why the more artificial intelligence, the more things are automated, or, I mean, even with our team members, we try and have them all on apps to the payroll company so they can manage a lot of that, just to remove, well, to give the team members or the patients better control and a better experience.
Thank you for sharing that, Bradley. Very much appreciated. And I want to bring Brian, I want to bring you back into the conversation at this point. Maybe you can speak to some of the technology practices that can really shore up some inefficiencies, and maybe also even share some of the benefits you've seen with maybe some of your partner organizations where you've really seen technology make a big difference.
Yeah, thanks, Brian. The panelists touched on a lot of it, but I think I want to highlight a few things that were said. When we say automation and streamline the patient experience, what are we talking about? Well, we've seen studies that are saying that patients or consumers are shopping their dental experience based off the technology those clinics are offering. So online appointments, online scheduling. I think Theresa nailed it. We've been using OpenTable to book a reservation for years. That is being shopped now in dental. Then take the RCM side of the world. Patients want to pay the way we pay, and I think Kai mentioned it, Amazon, 2-click payments, 1-click payment. If we didn't have a card on file on Amazon, how often would we actually purchase what we purchase from Amazon? Not as often. Amazon knows that. We know that. This is uniform across the board. So what consumers are looking for today is flexible options, more automated options. What that does in return is the provider can reallocate FTE hours to do what they should be doing anyway, and which is what we're all in this business for, is patient healthcare, not billing, not sending statements, none of the antiquated things we're talking about. So what we've seen across the board is staff shortages, mass amounts of acquisitions throughout dental, whether it's one location to 2, 5 to 10, 100 to 200. We have seen acquisition growth in dental at a pace that I don't think any of us really thought would happen, but it is happening. Inevitably, there is going to be a staff shortage. So whenever there is a new acquisition, there's a new legacy system in place. That means you're juggling multiple systems. Vendor management becomes important. Having technology is great. Having 4, 5, 7, 12 different systems just to implement said technology, not always as efficient. So what we're seeing is acquisition and then consolidating vendor management. What this does, it offers the patient a uniform experience, regardless of what location they go to. It then offers the RCM team and the provider team a more streamlined, back-end, high-level access point that they don't have to access the patient on 3 different text platforms, for example. So automation to fix the front-end shortages like payment integration, back-end consolidation of vendors, that has all been well accepted by not only staff, but again, consumers, in that shopping the experience has become paramount. So patient loyalty becomes important. So that's what we've seen across the board is consolidation, growth, scalability, and then streamlining the process for the patients.
Thank you, Brian. And a follow-up question for you, thinking about sort of the consolidation of these technology systems. I imagine there's somebody out there watching this right now who might be going through that right now or trying to execute on that process of really consolidating vendor technology. Can you speak more about maybe some best practices there, challenges folks might encounter?
Yeah, absolutely. The number one thing I suggest is asking how many dental clinics said vendors work with. Being consolidated is great. Not being consolidated in a dental market doesn't really hold as much weight. So first and foremost, ask about scalability or just recognition of healthcare. Do they understand dental? Do they understand the difference between post-adjudication versus in-clinic payments, for example? That would be where I would start. There's a lot of good vendors out there, so make sure they become more of a partner than just a payment vendor or engagement vendor. You should have a good rapport. You should be able to customize solutions. So my biggest advice or best standard I would ask or suggest is shop. Don't just go to one vendor and say, okay, let's do it. Look around. There's a lot of good vendors out there, and then make sure they have the scale or expertise in the dental market.
Thank you so much for sharing that, Brian. And maybe I want to open up a question about sort of searching for new technology in your various organizations. I'm curious how our panelists go about doing that. So Theresa, maybe we can begin with you again. How do you approach searching for new technology? Do you turn to peers for advice? Maybe rely on existing solution providers for recommendations? Do your own research, or is there something else that you sort of incorporate into that process to make sure you're successful?
So how we search for technology is a really good question, Brian, because I think in in historical context, we'd often search for technology to solve a problem that we're having. When you're in a DSO or you're in the leadership of a DSO, the types of problems you're encountering that you want to solve with technology are very different than the types of problems the people in the practices are encountering. And you've got to make sure that those interests are mutually aligned, or that they mutually benefit. Because if a technology is only going to benefit the analyst in an RCM department, but not benefit the people in the practice, the adoption in the practice is going to suffer. And so anytime you look to bring a new technology in, you've got to see who the stakeholders are and how are they going to feel about it. Dr. Dykstra could probably opine on this, and seeing he probably has thought some things would be great before, and they get in the hands of his dental assistant, and he doesn't understand why they don't think they're great and why won't they use the tool. We encounter this every day with technology. They're like, it was fine before. I was doing a great job at verifying insurance. Why in the world would you replace me with that? Here, do you see where they messed these three things up? And so you've got to kind of see them solving a problem they recognize they have. Yes, they might have messed these three things up as we were adopting it, but they came to work every single day and never got COVID. So it's kind of helping them see that it's going to be a force multiplier. And basically, I have to make sure the technology is going to solve a problem the user recognizes they have. And I'm dead in the water if I don't do that. And so that's my litmus test when I'm evaluating technology, is how will the user feel about it, and what's my protocol going to be to roll it out for user acceptance.
Absolutely. Thank you, Theresa. And Theresa, I believe you opened the door for Dr. Dykstra to opine. So I'm going to invite him to do just that. Can you talk about how you approach searching for new technology?
Well, it has definitely improved over time. Just historically, again, my first three computer systems, I asked what my friends have. They all went out of business. Finally, I said, who are the two biggest ones, and went that way. But also, I've learned over the years to take everything that a vendor says, look at it carefully, and especially when it comes to ROI, again, this would be more on equipment as opposed to this kind of stuff. So I've learned, I went back, got my MBA so I could do my own financial analysis also. But now what I do is I look, what are the best organizations doing? Not necessarily the largest, but some of the mid-sized, larger ones, and see what's working. And with a vendor, it's like, okay, if they're worth their salt, they'll be at all the meetings that I go to, all the DEO meetings, those kind of things. So you get to know them, you get to see their process. And again, for me, being at DEO meetings and talking to other people around the tables at lunch or during happy hour stuff, that's where I get some of my information. And then also I've learned, if I just make a decision and bring it back and say to the team, this is what we're going to do, probably not going to have too much buy-in. So I'll do the initial research, then I'll want, to go through a couple Zoom meetings or something with whoever I talk to, or, so they have an understanding of what we need. So I like sort of the group approach, and like Theresa, you said, the stakeholders, like, well, I might think it's great for insurance and accounts or RCM. And they're like, no, that's not going to solve our problem. That would make it worse. So, listening to people who have gone before me and listening to my team.
And then when it comes to listening to your team, can you talk more about how you sort of get that feedback? Who you tap on exactly? Is it a pretty large group? Are there certain folks you turn to more often than not?
It depends on the thing. If it has to do with RCM, I'll pick the people who do that. If it, there's a couple people in my organization that they're totally knowledgeable of that. They know the ins and outs. They know what it would take to implement it, what it would save. If it's more for a technology, like for teledentistry or online scheduling, then it might be a couple of the same people and a couple of different people. So it's more task specific. I try and pick the people, okay, who are doing it and who are in charge of it. So just to sort of get their input and hopefully their buy-in. And if they all say, yeah, after looking at this, and I really love this, it's going to help us out, then guess what? The implementation actually goes much better. The success is much, much better.
Makes a lot of sense. Thank you for that added clarity there, Dr. Dykstra. Kai, I want to turn to you now and see if you can weigh in on sort of how you approach searching for new technology.
So I agree with both Bradley and Theresa. It's got to be a bottom, a ground up approach. Really starts from the line level employees and the end users, the people who are, using the technology. So 100% in agreement. The only other thing that I would add is, obviously we're all very deep in the dental space, but when you look at healthcare spending, technology spending in the dental field, it's still lacking compared to medicine. So a lot of the technology that we are seeing in dentistry right now, for example, like artificial intelligence, AI, in terms of diagnosis, that's been around in medicine, in pathology for a while, and now it's moving into the dental space. So I think a good leading indicator is to look at what's working in the on the medical side. What are some of the emerging technologies that could be transferable to the dental side? Because I'm sure there are tons of bright and innovative companies out there. They will make that transition. But just the overall spending, I think dental is still lacking compared to medicine. And I think keep an eye on what's going on the medical space that could help us see what's coming down the pipeline.
Fascinating. So do you think there's room to look at internal processes and like I believe you mentioned earlier, make adjustments based on the patient journey, but also keep it like sort of looking outside the dental practice, the dental industry, and keeping track? You got to do both, is what I'm hearing, right?
Yep, absolutely. Yep, but it's got to start from within our space. Understand our workflow and how our people utilize technology. That's got to be the starting point. But just keep an eye on what's out there in other industries.
Makes sense. Thank you so much, Bob. I want to give you a chance to weigh in on this as well.
Yeah, in just looking at technology, like my peers have already talked about, it's first and foremost involving the right stakeholders to understand the scope of need. What are you trying to solve, or what are you trying to build for? And then obviously having that committee, if you will, evaluate a variety of solutions, because there's many off-the-shelf solutions. We have a pretty robust IT function. Some things are created in-house. As an example, our current practice management system is proprietary, in-house. So as we update, it's actually the configuration, the design is done internally. But as we're shopping third-party solutions, again, it's a matter of understanding the need. If it's an HR or talent acquisition process, I have a group of people on my team that will evaluate capabilities and functionality. And then once you've selected it, obviously the right type of people adoption process, which includes certainly communicating what's going to happen, what the selection was, why it was selected, and how we're going to train people, proper training on the system, so that when you do go live, the system is functioning the way that you want it to, that people are prepared to use it the way that it's designed, and you ultimately get the outcome with minimal disruption and frustration.
Thank you, Bob. I appreciate everyone's responses there. And we are going to get to the audience Q&A portion of this soon here. But I want to first ask each of our panelists to sort of weigh in on this next one, which is I want to hear about future plans, potential future plans for more technology being injected into the practice, or any other areas of priority for your organizations. Bob, I'm going to tap on you to get the ball rolling this time.
Can you rephrase the question for me?
Yeah, absolutely. Do you have any future plans with technology to get more technology into your organization? Any major priorities you're focused on right now?
Absolutely. We continue to look at the capabilities of technology and how that will enable us. We're looking at just on the human resources side, how we can certainly connect with our team members more efficiently, communicate information, provide training, and obtain feedback. One area that we're significantly working on is the implementation of an engagement software platform that enables us to take information across our enterprise and get, certainly feedback to common questions, but the ability of this platform to enable us to stratify that data, whether it be by job function, geography, leader, and build individual action plans timely. What I think many of us may have seen in the employee engagement world is you get all of this information, but stratifying the free text comments, the just numerical Likert scale responses, and then being able to stratify it and put it into action plans and follow up. Well, by the time you get all that done, you're halfway through the year, and how much traction are you going to get on it? So really being able to get the information more efficiently, do something, understand it, and actually implement some actions to make desired changes to, in our case, improve employee engagement. So that's just one example that's within my lane. And that new platform is actually being launched within the next 30 days.
Wow, appreciate you sharing that. It's got to be pretty exciting. The prospect of really getting your arms around all that data. There's got to be maybe I would assume just a treasure trove of actionable information there.
That's exactly what we're expecting to see, and making it more actionable and relevant to different segments that we may build actions around. It's not a one-size-fits-all. We're, like I said, in 5 different states, many different municipalities, and if you've seen one office, you've seen one office. So it enables us to be a bit more nimble.
Appreciate that. You sharing that, Bob. Theresa, I'll turn to you now to share maybe what you're working on, any future plans at Dental Express.
So our future plans probably center more around the clinical side. We've really focused a lot on the patient engagement with technology in the past, whether it be through appointments, through RCM, record keeping, texting back and forth, payments. The clinical side, however, we've been really there on image capturing and x-rays, kind of looking across the universe of what's happening with treatment plans, implementing technologies where we're able to better read the radiographs and calibrate the care across our clinicians, I think is going to be the next wave. Also being able to calibrate what's happening in our notes. Are there keywords that are happening? Are we remaining compliant with any government programs that we are ascribed to? That's been a very manual process in the past with respect to audits. And so being able to sample data across these cloud-based practice management systems, I think is just going to elevate the level of care. And we're going to identify opportunities for growth in our clinicians much sooner.
Appreciate you sharing that, Theresa. Certainly some exciting potential there. Kai, how about you? What future plans are you focused on?
Yeah, so there are two major groups of initiatives that we are actively engaged in. Number one is just, as I mentioned earlier, looking at a patient journey and looking at all these, different contact points. What can we do to make all these contact points, make it, easier for our staff, but also, smooth for our patients, for our guests. And, that could be, insurance, automated insurance eligibility, using AI to get that information. And then the other groups of initiatives is really, we are working with our RCA team, a revenue cycle management team, to look at, EDI 835, auto posting, and that entire workflow. What can we do to take the manual posting out of our workflow, and again, faced with a shortage of qualified candidates, we want to redeploy our experience and our RCM team members to focus on other tasks that can actually increase value. So these are two groups that we're working on.
Yeah. Certainly a theme that's run through this discussion of really getting staff to focus on more value-added tasks that are really move the needle on more things versus stuff that the mundane that nobody likes to deal with.
Right. Absolutely.
Bradley, how about you? What future plans are you focused on?
All right, I'm there with Theresa. We're very much looking at artificial intelligence for radiographs and charting, so it can compare radiographs, put that information, and highlight a lot of areas of concern. I'm really excited about that because, like somebody said, trying to get some standardization among clinicians, doing chart audits, that kind of thing. It will make things much easier. It should also make things much easier for insurance reimbursement. So that's kind of on my plate. I think from the front end type of things, we're really trying to focus on really using all the technology that we already have to its full potential. There's still a lot of stuff that we could be doing using the technology we have to do better. And yeah, one of the things we want to also, it's down the road a little bit, but we're keeping our eyes open for better solutions for revenue cycle management. I mean, that's always getting more and more complex. But we're hoping with the artificial intelligence and the diagnostic side that will help us on both sides. Right, Theresa? I saw you now.
You're 100% right, Dr. Dykstra. And the connection between RCM and clinical, I think, is one that will leverage us in 2022 to really increasing the amount of care we can help provide.
Absolutely.
Thank you both. Before we jump to the audience Q&A portion of this, I want to turn it back to Brian. If you could share a bit more what you've heard through this last stretch of the conversation here, or any other thoughts you want to share with the audience.
Yeah, absolutely. I think that all that information was amazing, right? So on the vendor side of the world, we love hearing what the providers and the clinics are thinking, are wanting, are needing. In my opinion, when we think about the patient experience, whether it's payments or engagement, clinical versus RCM, everything's going to be done from this, my cell phone. We believe that, and we believe that is the future. So we believe things like checking out at the front desk, it's going away in the coming future. So everything we see and everything we hear is around this contactless environment. We want a patient to be able to walk into the practice, get treatment, leave the operatory, and go home. Everything should be done, and will be done, by the way, on a cell phone in the coming years. So we see innovation as the paramount function of what Rectangle Health is trying to do, because our clients, our providers, are telling us that's where they want to go. I believe that to my core, and I think this is a great example of how innovation and technology and software can streamline workflows for the patients and the staff.
Absolutely. Thank you so much, Brian. Thank you to all the panelists. It was a great discussion. Really appreciate the valuable insights you shared with our audience today. And we're now going to engage with some of the audience questions. So as a reminder to folks out there, you can enter questions into the Q&A chat box on your webinar console. And the first question, actually, Brian, picks up exactly where you sort of left off with the last statement. So maybe you'd be a great person to kick off the Q&A portion here with an answer to this attendee's question, which is, how is AI being used to impact efficiency and the employee or patient experience?
Yeah, great question. So we've seen three major issues and then conversely three major consequences of implementing technology. The three main issues are basically no staff or lack of staff at the front end, vendor management being an issue, and then automation or lack thereof of automation. So a lot of manual effort, a lot of different systems, short staff, which leads to a lot of back-end billing. Those are kind of the issues we're seeing. Once technology is implemented, we've seen a return on improved collection rates nearly immediately by automating the patient payment, patient engagement process. Reduce days in AR, think text to pay. Something as simple as a text has a massive improvement on return than a paper statement. And then just pure efficiency. Calls to the practice have gone down. Paper statements have reduced. So by implementing technology, we're handling the front end and RCM issues and then providing those three main benefits, which again are improved collection rate, reduced days in AR, reduced FTE or reallocate FTE workload.
Excellent. Thank you. Thank you, Brian. The next question we'll jump to is the attendee asked, with sort of this discussion around automation, she's curious of what you're seeing or hearing in terms of automated inventory management using RFID technology. For example, she lists smart cabinets that are track transactions in real time. Does anybody want to speak to that question?
I could speak to it a little bit. We're not as sophisticated as putting RFIDs into cabinets, but we are doing some analytics to predict inventory systems. You know, looking at ordering history, looking at where we're headed, and so we are leveraging some technology to start predicting when we're going to run out of things sooner, or if we're doing a bulk purchase across several of the locations at one time.
Thank you so much, Theresa. Anybody else? We're going to jump to the next audience question. There's been some great ones. Appreciate the engagement from everyone. So the attendee says, so many great technologies available to automate front and back office tasks, but there's also a learning curve for staff in adoption. How do you strategically implement new technologies without actually overwhelming staff? A great question. I think we touched on this a little bit. Dr. Dykstra, maybe you're the right person to turn to get the ball rolling here.
Well, maybe I'm not, but I'll give it my best shot because I tend to be a quick start. Here it is. This is how you use it. Make it work. But again, my team are like, okay, we need to create an action plan. We need to spend some time on training. We need to make sure people know the why we're using it. So we've found you don't buy it one day and start the next. And even when we acquire new practices or whatever, we'll like keep them on their software for 3 months and use those 3 months to train them on the sandbox of our software. But what I really love, and Brian, this is for any vendor really, the more like online tutorials that exist that they can watch. And even better if there would be, we'll call it the sandbox, where they could go in and play with it a little bit and see. So, because some people are so afraid of, oh, what if I press this button, I'm going to mess everything up or everything's going to disappear. So if they have some good tutorials, short ones, keyword being short, like TikTok, and then possibly the sandbox. So that's what would help us. But we're finding just letting them try and experience it before they have to do it live.
Yes, that makes a lot of sense. Some hands-on experience before they're fretting over potentially clicking on something that they think will do irreparable harm. I appreciate you sharing that. We can jump to the next question here, which is sort of builds on the conversation we've been having. The attendee asked, what difficulties have you experienced in implementing automation with your current practice management systems, particularly if they are homegrown systems or if you have multiple PM systems? Anybody eager to jump at that one?
I could. Oh, go ahead.
Yeah, sorry, Theresa, go ahead.
So I think when you talk about disparate practice management systems, you also need to look at disparate patient care systems, and even you could have 10 practices all in the same practice management system using it differently. And so understanding how they define certain terminology or define tasks is very, very important. Whether some people call something a recare, some call it a recall. And that may seem just silly or like low-hanging fruit, but there's so much terminology throughout the work day that gets thrown around. And if you don't have those definitions set before you go into an implementation, you could be speaking two completely different languages during the training process and the implementation.
Thank you, Theresa. Brian, do you want to hook on there?
Yeah, very quickly, I'll highlight that whenever there's multiple systems in place, it's imperative to have one consolidated solution that is bridging the gap for what you're trying to accomplish. The other option is going and get 3, 4, 5, 6 different vendors, which isn't necessarily the worst thing in the world, but it's also not the most streamlined thing, which we've been talking about. So anytime there's homegrown EMR, PM systems, or just disparate systems, it's all about finding a vendor that can consolidate or a partner that can consolidate into said systems.
Thank you, Brian. Bob, did you want to weigh in as well?
Yeah, because I think our situation may be unique that as we integrate practices into, our we'll call it portfolio of practices, ultimately we migrate one of our offices onto the same system. So there may be a period of time where a particular group of offices may be on a legacy system, but ultimately we do make a migration so that we have, number one, a common system and common utilization of the system. And I think to Theresa's point, it's part of that adoption process and why it may not be a day one when an office becomes part of our portfolio is that people adoption, that training, that understanding of common utilization of the system. And typically when we bring a new office in, it's headed up by somebody who's been experienced with our systems, and that's how people maybe move around our offices. But it's also critical to be able to get the data out of each system during that bridge period to be able to understand how you're performing, what you're needing to do, and align with other offices. So that's a whole other process during that migration and utilizing disparate systems or separate systems, particularly on the practice management side.
Appreciate that, Bob. Kai, I want to see if I can bring you in here to speak to this point too.
Yeah, for us, we have an off-the-shelf practice management system, so I can't really speak too much as far as the homegrown systems. But one of the things that I'm beginning to see as we explore different tools to implement in our patient journey is, we're seeing there's overlapping areas, right? You may have one vendor that handles payment, another vendor that handles, online reputation management, and then another one that handles digital workflow automation, virtual check-in. And then, they all have started to overlap. So one of the things that we're looking at doing is really just to consolidate, because we don't want to create, additional layers of complexity for our folks in the field, is really to look at, what is that one tool that we can use? Instead of having, two vendors, can we go with one vendor that can perform all these tasks for us? And we're seeing vendors out there, actually, they're offering more and more services. And it's very interesting to see that, in the dental field.
Absolutely. Thank you, Kai. And yes, that consolidation certainly has been a running theme throughout this conversation. And it's been a great one. We've got 1 minute left. Brian, any final thoughts?
First, just thank you everyone for joining, and thank you for this great panelist. My final thought is, if you do see any need within your organization, there is a technology out there that can help. So obviously, feel free to reach out to the panelists or myself. We'd love to talk. There's a lot of knowledge on this call. So technology is here to stay. It's not going anywhere, and there's a lot of good ones out there.
Thank you, Brian. Perfect place to close. That will be all the time we have for today. Thank you, Bradley, Theresa, Bob, Kai, and of course, Brian again for an excellent discussion. Also want to thank Rectangle Health for sponsoring today's webinar. To learn more about the content presented today, please check out the resources section on your webinar console and fill out the post-webinar survey. Thank you for joining us. We hope you have a wonderful afternoon.
Thanks, everybody.
Thank you.
Thank you.